Okay. All right. So the respiratory system, okay? The respiratory system supplies the body with oxygen and disposes of carbon dioxide, okay? I'm pretty sure all of you guys are familiar with oxygen. The disposing of carbon dioxide is less familiar, but you need to get rid of carbon dioxide or else you get carbon dioxide poisoning, okay? Or respiratory acidosis, okay? There are 4 processes that are involved in respiration. Pulmonary ventilation, so breathe air in and out of the lungs. External respiration, getting air from the outside into your bloodstream. Transport of respiratory gases, moving the oxygen around. And internal respiration, getting the oxygen from the bloodstream into your cells. Okay? Okay, the respiratory organs are all listed there, with the exception of the paranasal sinuses. You have to know what they are, okay? And so you have to know everything that's on here. Okay, the organs of the respiratory system are divided into the conducting zone and the respiratory zone. The conducting zone is all tubing, okay? This goes from A to B. Okay, it humidifies and warms the air, but doesn't actually do the most important thing, which is gas exchange. Gas exchange are only done in these small structures called alveoli. Okay, okay. The nose provides an airway for respiration. Okay, it also warms the air as it comes in and filters the inhaled air. That's what all the nose hair and all the other stuff are for. Okay. Okay, the nose size is due to differences in nasal cartilage, not the bones, but the cartilages. Okay, the bigger the nose, actually, if you come from colder and drier air, then you need bigger noses to warm and filter the air. So that's where that comes from. Okay. Okay. The nasal cavity. Okay, so here's the nasal cavity. It's divided by the nasal septum, so you have left and right halves. Each of them has the nasal meatuses. Okay, so here they are here. Okay, and the nasal concha, which outline the meatuses. Okay, so the nasal concha. The whole reason for them is when you breathe air, you're not just breathing in air, you're breathing in dust, you're breathing in bacteria and viruses and all of that other lovely stuff that's in our air, okay? And so when you breathe it in, you do not want the air to go straight back into your lungs. You want it to kind of swirl around your nasal cavity. That's what the nasal concha are for. The nasal concha generate turbulence. Okay, so the turbulence causes the filter to actually trap all the bacteria or most of the bacteria and viruses, and then you end up swallowing that and not letting it into your lungs. Your lungs are supposed to stay clean. Okay, okay, that's the nasal concha. Okay, the next thing is the nasal pharynx, or sorry, the pharynx. The pharynx is commonly known as your throat. The pharynx is split into nasal pharynx, oral pharynx, and laryngeal pharynx. The nasal pharynx is air only. Okay, you are not supposed to get food up into your nose. Okay, so the nasal pharynx is air only, and therefore the epithelium is a lot thinner. Okay, the uvula reflects superiorly. So let me show you what the uvula is. The uvula is this flap right here, like when you have someone open their mouth and you look really deep into their mouth, you have this little flap that hangs down. Okay, that little flap is the uvula. That little flap will flip up and seal off your airway when you swallow. Okay, if you accidentally shoot water up your nose and stuff, that happens when you laugh and breathe at the same time. So what happens is this flap gets confused. When you try to swallow, it has to go up. When you try to breathe, it has to stay down. So when you try to do both, it doesn't know what to do. Okay. All right. The next thing is the oral pharynx. The oral pharynx is connected to the mouth. Okay. That's why you breathe through your mouth if they shut off your nose. Okay. And then the laryngeal pharynx. These two things are shared between both the digestive tract and the respiratory tract. Okay. And because the respiratory tract, or because the digestive system tract is much rougher, and you have to pass food through it, the epithelium here will be for the digestive tract. Okay, the stratified squamous epithelium. Okay, the larynx, okay, runs from the hyoid to the trachea. The three functions of the larynx, okay, is the voice production, okay. When we speak, we're using our larynx, okay, so like laryngitis, okay, and provides an open airway and routes the food and air into proper channels. So anything after this, okay, beginning at the larynx, is going to be air only for the respiratory system. Okay, so let's look at the superior opening first. The superior opening, so that's the opening. So that piece right there is called the epiglottis. Okay, that piece right there is called the epiglottis. When you swallow, this piece comes down on top of here and covers the larynx, and it forces the food to go backwards. Okay, and back here, okay, where it says cartilage and stuff, is actually where your esophagus is. Okay, so that piece is the epiglottis. The only other piece of cartilage that you have to know is this piece right here. That's the thyroid cartilage. The thyroid cartilage, okay, has this sharp pointy thing in front called the laryngeal prominence. Okay, that gets bigger. That's a sexually dimorphic thing. It gets bigger in men, so it's called the Adam's apple in men. Okay, and it actually allows men to have a deeper voice. Okay, you can see this line right here is called the vocal cord. The vocal cord is actually attached to the thyroid cartilage, and because the thyroid cartilage is bigger and larger in males, okay, it causes the males to have a deeper voice. Okay, that's why boys' voices get deeper as they, hit puberty and stuff. Okay, so you can see that there. Okay, when you swallow, that is supposed to be closed. When you breathe, that's supposed to be open. Okay, when we want to speak, we tighten the cords and we push air through. Okay. The length of the vocal cord changes with pitch. Okay, so the tighter we make the vocal cords, the higher pitch. The loudness depends on how much air we push through. Okay. All right. The innervation of the larynx is the recurrent laryngeal nerve. It comes off the vagus nerve, and it's actually really kind of cool because it starts off, so your vagus nerve from the base of the brain, for some reason the laryngeal nerves comes off below the heart, okay, or below it comes all the way down to your chest, goes around the aorta, goes all the way back up to your larynx. Instead of going directly from your brain to your larynx, it goes all the way around the heart. And there's no real reason for this other than this is what happened to fish 500 million years ago. It hasn't changed since then. Okay. All right. The trachea. Okay. The trachea is a long tube, so this is your trachea, and your airway is always open. So your food passageway, your digestive tract is usually not open. Your airway always has to remain open. And so keep it open, you have these C-shaped cartilage rings that protect your airway. All right? So, okay. The carina is the very end of the trachea. Okay. So you can see the trachea here, and you can see the position of the esophagus that's missing in the other pictures. The esophagus is directly attached to the very back of the trachea. Okay. So coming down off the trachea or bronchi, okay? The trachea is going to split into two primary bronchi or main bronchi, okay? I'd rather use primary than main, okay? But either answer is acceptable, okay? The right main bronchi is wider and shorter than the left, okay? So trachea, okay? The most straight path is the right bronchi, straighter and larger than the left, okay? So if things were to get stuck in your trachea, it will end up here more often than there, okay? You can see your left lung is a little bit more out of the way than your right lung. And that's because if you haven't realized that your heart is right here, your heart is more on the left side. So your left lung is slightly smaller than your right lung, okay? All right, the primary bronchi split into the secondary bronchi. The secondary bronchi split into the tertiary bronchi. Okay, the tertiary bronchi split and split and split and split. Okay, so it's not just 1, 2, 3, 4. There's a lot between the tertiary and the bronchials. Okay, there's like 20 something levels of folding. Okay, but eventually you get to the bronchials. Okay, let me explain what the bronchials are. Okay. The trachea is surrounded by cartilage. This is all surrounded by cartilage, okay? But as you get smaller and smaller tubing, the cartilage gets thinner, it gets more sparse. So you can see that, like there's cartilage here, but the cartilage gets more sparse. By the time you get to the bronchioles, there is no cartilage at all, okay? With no cartilage at all, the only thing keeping the airway open is the smooth muscle, okay? The smooth muscle, okay? So you can see there's no cartilage here, so it's all surrounded by smooth muscle. Smooth muscle I can constrict and I can relax. So when you have asthma, is when the bronchioles constrict, okay? And they constrict to a very, very small size. That's why one of the feelings of asthma is like you're feeling you're breathing through a straw. You're not getting enough air because you went from this open hole to this tiny little hole, okay? And the way to treat acute asthma attack is dilation, right? So it's sympathetic stimulation, so opening up the airway. Okay, you do not have to distinguish between respiratory bronchioles and terminal bronchioles. Okay, okay. You also do not have to distinguish between alveolar ducts and alveolar sacs. Okay, so just alveoli. Okay. Okay, alveoli account for a tremendous surface area. Okay, the surface area of alveoli is 1,500 square feet, which is like the size of a house. Okay. Okay, there are two types of cells that live in your alveoli that make up your alveoli. They're type 1 and type 2 cells. Type 1 cells are a simple squamous epithelium. Okay, for gas exchange. Okay, type 2 are called type 2 alveolar cells. Okay, or they're also called surfactant cells because they secrete surfactant. Surfactant reduces surface tension within alveoli. So, okay, here is a paper towel. Okay, when the paper towel is dry, okay, they don't stick to each other. The membrane doesn't stick to each other. However, if you add water, okay, so if you add water, now the paper towel sticks, okay, and it sticks really well. So now I can't really unfold this very easily, okay. So that is your lungs, okay, your alveoli. Your alveoli are all wet, so they should stick together. But what's causing them not to stick is surfactant. Okay, surfactant reduces the surface tension within the alveoli. The reason why the water sticks together is because water likes this thing called surface tension. Okay, by secreting surfactant, it causes the water not to stick to one another. Okay, and that makes opening your lungs easier. Okay, so why is this important? Because as a preemie, so if you're inside your mother, you're not using your lungs to breathe. You're getting your oxygen from your umbilical cord, right? So you don't need your lungs to breathe, and you're not actually breathing, so you don't need surfactant. So you don't make surfactant until you're ready to be born. Okay, that's one of the last cues to get the body ready. So if you come out premature, then you're not able, you don't produce enough surfactant to make your lungs expand. That's why you end up on ventilators, okay, or respirators. Okay, if they know you'll be premature, twins almost always premature. They give you steroids, okay, to speed up lung production. Okay, so you can breathe on your own. All right, the last type of things is the alveolar macrophages. These are also known as dust cells. They literally collect dust from your lungs, okay? And then they move into the alveoli, and then they go wherever they want to go, okay? Okay, so alveoli for gas exchange, you can see, okay, remember the blue is actually the branch of the pulmonary artery, because this is deoxygenated blood, this is oxygenated, or this is deoxygenated blood, the pulmonary artery, and the pulmonary vein is actually oxygenated blood. Okay, okay. So the gross anatomy of the lungs, okay? Yeah. The apex is the tip of the lung, okay? the base along the diaphragm, okay, the base, okay, the place in the lung where everything enters and exits is called the hilum, okay, okay, so your left lung and right lung are slightly different, so your left lung is smaller, okay, it has 2 lobes only, so top and bottom, so superior lobe, inferior lobe. The fissure, it runs diagonal, so it's called the oblique fissure, okay? In the middle of the superior lobe is a big indentation where your heart goes. That indentation is called the cardiac notch, okay? Your right lung has 3 lobes, okay? So superior, inferior, and middle lobe. So between the superior and middle is the horizontal fissure. Between the middle and inferior is the oblique fissure. Okay. The easy way to remember this: your bicuspid is on your bicuspid. Bi means 2. The bicuspid is on the left side. Your tricuspid, tri means 3. Okay. So your tricuspid is on the right side. So tricuspid 3 lobes, bicuspid 2 lobes. Okay. Okay. Pulmonary arteries. Okay. The pleura is a double-layered sac surrounding each lung. There's a parietal pleura and a visceral pleura. Okay. So parietal pleura is on the outside of the lung. The visceral pleura is on the inside. Okay. That cavity. Okay. It's called a pleural cavity. Okay. The 2 pleural cavities are separate from one another. If you puncture the pleural cavity, it makes it hard to breathe. It's called pneumothorax. Okay. Okay. Inhaling and exhaling. The purpose of inhaling, okay, is when you inhale, you purposely want to make your lungs as big as you can, and by making your lungs as big as you can, okay, you decrease the pressure, okay, in your chest, and therefore air rushes in. Okay, when you breathe out, you pressurize the lungs, and air comes rushing out. Okay. Okay. So deep inspiration. Okay. So when we normally inspire, we use our diaphragm and our intercostals. When we deeply inspire, when we're like sucking in gas, like we can use just about any muscle attached to your torso. Okay. Scalenes, urocleidomastoid, pectoralis minor, erector spinae. Okay. When we breathe, breathing out is usually a passive process. We don't actually actively do anything. Okay, we just relax the muscles. But we can forcefully breathe. Forcefully breathing is like pushing air out on purpose. And that's also like yoga breathing. We use the ab muscles to do that. Okay. Okay. The neural control ventilation. It's located in the medulla oblongata. Okay. We measure, okay, the baseline respiratory rate in the medulla oblongata, but we also have chemoreceptors that are sensitive to falling oxygen levels. And also, I'm not sure why they don't cover this in anatomy, but they'll cover it in physio, CO2 levels. It's the CO2 levels that actually make you want to breathe. So, okay, hold your breath. Okay, as I'm talking, just hold your breath. And what you'll feel is the need to breathe more and more. The reason why you need to breathe more and more is not because you're running out of oxygen. It's actually because the carbon dioxide levels are building up in your bloodstream. And that signal in your brain, you need to breathe more and more. Okay, so breathe. Okay. Okay. The reason why when you run or when you exercise, you need to breathe more. Is because as you run, you're burning more sugar, so you're burning more CO2. Okay, and you need to get that CO2 out of your bloodstream. Okay, so we talked about bronchial asthma already. Cystic fibrosis is the other disorder that you should know. It's a genetic mutation that causes the exocrine gland mostly in the lungs to be disrupted. It's actually a pump that pumps out chloride, but along with chloride comes water, okay? And water washes things out of the mucus and washes it out. Without the water coming out, the mucus becomes too thick. And thick, gooey mucus that's not moving anywhere, and so trap a lot of bacteria. And so one of the symptoms of someone having cystic fibrosis is constant respiratory tract infections. Okay, and these are usually bacteria that are not harmful to you, but to a cystic fibrosis patient, they're deadly. And one of the most ironic things about cystic fibrosis, the last place a cystic fibrosis patient wants to be is around someone else with cystic fibrosis, because they will just trade bacteria. Okay, COPD, chronic obstructive pulmonary disease or disorder. Okay, so this stuff. Okay, emphysema, the destruction of the alveolar walls. The alveoli have to have a large surface area to gas exchange. If you destroy the alveolar wall and you destroy the elastin in the lungs, then you're not sucking in air very well, and because of that, you have to breathe harder. Okay. Okay. So you can see the alveoli differences between emphysema and normal. Okay, and I can tell you firsthand, the lungs themselves feel very different. A normal lung should be squishable. A person with emphysema, their lungs are not squishable. They're like, it's like squeezing a dead fish. You don't squeeze very far. Okay. All right. So that's it for this presentation. And so public service announcement: don't smoke, because you definitely don't want this. Okay. All right. So just because you guys aren't here, someone ultimately asked about marijuana always. So the answer is yes, marijuana, the effects of marijuana cigarettes are bad for you. That being said, the amount of marijuana smoke you get in your lungs is nowhere near the amount of tobacco smoke you get in your lungs. Per puff, the marijuana is probably worse, but people smoke a pack a day, and that's relatively normal. People do not smoke a pack of joints a day. At least I've never met anyone who does. And I went to the pot capital of the world. Yeah. So don't worry about, lighting up a joint or something. Okay. So don't tell anybody I told you all that. All right. See you guys later.